Hello, my name is Dr. Chaitanya and welcome to my new YouTube video. So practical number 10 regarding the bone tumor and pathology of the bone. You have to supposed to write down all these things in your record book, and you have to draw the microscopic figures of things. So coming to the lesions of the bone, the mnemonic is vitamin, which means stands for the vascular actions, mechanicals, trauma, anomaly, metabolic disorders, inflammatory, immune, neoplastic. These are the 7 categories basically by which you can divide the bone lesions. Out of this, you have only 2 for practical, that is the inflammatory lesions and the neoplastic lesions. So to the inflammatory lesions, the osteomyelitis and tubercular osteomyelitis. So osteo means bone, myelitis means infection. So bone infection, there are the different causes like bacterial, fungal, viral are very rare in case of the bone infection. So coming to the causes, for adult it is Staph aureus, for neonates it's Haemophilus influenza, and from the in the patients those who are having sickle cell disease, then the Salmonella typhus. So these are the main bacterial causes by which bone may get infected. So why bone get infected by bacteria and where the place is, that is also important by the anatomical side. As everybody knows, the long bone can be divided into the epiphysis, metaphysis and the diaphysis. And in case of the metaphysis, there are the blood supply to the bone, which actually appear like a hairpin shape in case of the metaphysis. So here you have a growth plate and here you have a metaphysis. So this is the place basically where most of the time your bacteria will resides and bone get infected. So here you will get the most of the time bone infection. So coming to the osteomyelitis, pyogenic osteomyelitis is pyo means bacterial, and the causes, it may be acute or chronic. So basically in case of the chronic, there are the 2 things which we can learn, that is the involucrum and sequestrum. So these are the 2 terms you should know, what is meant by involucrum and what is meant by the sequestrum. When there is a bone infection, either it is due to the acute or chronic, either bone will give a reaction, so that reaction is called as the reactive bone tissue, and when there is a residual bone or dead bone, it is called as the sequestrum. So these things can be seen in case of the bacterial infection in the bone, that is the pyogenic osteomyelitis, and this is the gross picture of the osteomyelitis. Coming to the microscopy of the osteomyelitis, there are the inflammatory cells, marrow fibrosis and disorganized, disvitalized trabeculae. So this is the picture of the bone, which shows that there is inflammatory cells, there are the marrow fibrosis, and there are the disorganized, devastated trabeculae. So these are the trabeculae. How bone look actually under the microscope? If you see the bone marrow biopsy or bone, like there are the trabeculae. Okay, there are the trabeculae, and in between these trabeculae you will get your bone marrow, which contains the RBCs, WBCs, and all hematopoietic system is there. So coming to the another gross of tuberculous osteomyelitis, it is the name, it is suggesting that the osteomyelitis, that is the bone infection due to the tuberculosis. So we have the gross picture of this in our this is the gross specimen in our laboratory. Here you can see that this is the bone which is fixed in the paraffin, and this paraffin block has been kept in the formalin. So this is the picture of bone which is showing the sinus like lesion. So here you can see that this is the tuberculous infection, and it is having the involucrum and the that is the reactive, and then the another one is the residual, that is the dead bone, also called as the sequestrum. So this is the gross picture, and this is the microscopic picture, which we don't have, but we have the another side of tuberculosis. But in case of the microscopy, as we all know that tuberculosis having caseous necrosis, there are the epithelioid cells, which are the slippery shape. Then the Langerhans types of giant cell can be seen, which are multinucleated, and the necrotic bone. So these are the features of the tubercular osteomyelitis under the microscopy. So thank you.